Hi everyone, it's Miko here. I know you are not probably expecting me to start in English, but today we are going full English mode, so hang in there. Cause when I was editing this video, something suddenly hit me. Wait, did I ever upload my 6 months update on my English progress? Actually not. That's why I'm here in English. And I came to Canada in last September, so technically it's been about 8 months ago. But the video I'm about to show you today was filmed in February or March, so officially I can count it as 6 months progress, right? So anyway, let's go with that. So I recently had an extensive interview and Wade helped me practice for it, and we decided to film the video just in case. Then guess what, I passed actually. Yeah. And maybe some people don't know about extensive. Actually, I feel you because I had the same question a few months ago. Extensive is about for, don't know how to say, extensive is for nursing students like me. It gives those people to get the chance to know about real life in the hospital. Actually, it's it gives the advantage for both me and the hospital to know each other, and it's like a test run. Yeah, test run to do the real work as a nurse. Yeah, I'm technically a nursing student, but it's a good chance for me to know about what's going on in the hospital, how to work as a nurse. So yeah, it's like a test run. Yeah, I will work as an extra in the hospital at the end of this month. I'm so excited. Yes, it's kind of new life in April. It's refreshing, right? And in terms of Wade, maybe some people don't know about Wade. I'm talking about him in other video, but he is my landlord in this house, and he is also a morning person and I'm also a morning person. We woke up 5 a.m. Each other, and we drink smoothie and had lunch, have breakfast and have lunch and dinner and watching some movie together, chatting all the time. Yeah, he's so awesome landlord for me. Anyway, this video is about our interview in English. So if you are preparing for a nursing job or extensive, please feel free to use this for your practice. And also, I cannot believe I've been 6 months since I came here in Canada. It's insane, time flies, right? So maybe it will be fun if you see how much I improved English compared with that video. Yeah, this one. Can you play it for me, Miko? Thank you. Actually, the editor is also me, so can you do it for me? Okay, today I'm gonna talking about my morning routine and my new life in Canada. Okay, before that, I will talk about my introduction a little. It's my English skill, day 3 in Canada. So it's kind of fun. Maybe it would be fun for you guys to see how much I've improved English. And yeah, it's been 6 months, but still now I cannot pronounce all sound actually. Will always make fun of me, make fun of my English pronunciation, but actually I care, but I don't care because it's my accent, it's my Japanese accent. I cannot pronounce all sounds still now, but it's been just 6 months, right? I can do it better in the future, I hope. So I will keep practicing my pronunciation, my English skills, my way to use English. Don't know how to say. I will improve my English more and more. I will keep studying more, but yeah, this is my skill. This is my level of English. So I hope you can get some brave, or you can get some motivation. I don't like this word, but I hope you can get some motivation from my video. And also I've done the conference presentation in English back in Japan. So if you are curious about that, please go check it out as well. Enough chatting. I'm so talkative person. So yeah, let's go back to business. Let's go.
Can you describe your experience with patient assessment and how do you prioritize care?
When I was in Japan, I worked as a nurse for 3 years, and I met a lot of patients who have some disease. The question is, what did you say?
I asked you your experience with patient assessment and how do you prioritize care?
When I worked as a nurse, there are a lot of tasks. I have to do the multitask, and sometimes it's difficult to find out the priorities. But when I was confused, I talked with other staff, and I decided like which care is the high priority. And also when I have some concerns, I always talk with some seniors and the church nurse. But I try to assess the patients with my knowledge, so I keep studying about the diagnosis and symptoms of the disease.
How do you handle a situation where a patient's condition suddenly deteriorates?
When I find out if their vital signs is not normal, I will just check the safety first and then go to some seniors or some call the doctor about the symptoms. It depends on the symptoms, but I just call for help and check the safety.
How do you manage and document this patient care with all of these symptoms? And how do you ensure that it's accurate and compliant with our hospital policies?
How do I know if it's the correct or not?
Well, how are you managing it? So if you're doing a checkup on a patient and you're doing a report on this patient and you're checking things, how are you make sure it's accurate? How are you documenting it so the doctor and other people can see it? And how do you make sure that all of your notes that you're making are compliant with the hospital's policies?
How do I document? How do I chart?
And how do you make sure it's accurate? And how do you make sure it goes with the hospital's policies?
I will follow the hospital policy, and I think there is some guidelines too of how to chart of the patient's condition.
Do you have experience doing that? In Japan, did you have experience in making sure that you took notes and you made sure those notes were accurate and that the doctors could make sure that they can see those notes and that they were to the hospital policies?
Like there is some example how to chart like S-bar. Like it's so concise and simple, but it's also detailed. I try to I don't write so long sentence, just write about the symptoms or like what I want to tell to the doctor.
Okay.
To check it later.
Yeah. What steps do you take to ensure medication safety when administering drugs?
In terms of scope of practice of extern, I cannot give the medication. So if some nurses ask me to do it, I will say it's not my scope of practice, so I cannot do it.
Okay. Tell me about a time you had to deal with a difficult patient or a family member. How did you handle the situation?
If I have difficulty to handle, I think depends on the patients. If the patient's condition, like if some patient have dementia or their condition is delirium, I think I should speak calm and slowly, try to handle them. But if it's so difficult for me or if they are so aggressive, I will call for help to other staff. And also if I have some concerns or difficulty to talk with patient's family, I think I shouldn't handle by myself. I need some other staff. So I will call for help as well.
And what about difficult family members?
For example, if they feel concerns about patient's symptoms or patient's condition, I think they need some advice from doctors or nurses.
Describe a situation where you made a mistake in patient care. How did you correct it? What did you do to correct it? And what did you learn from the experience?
Mistake.
Have you made a mistake
Yes.
in patient care? And what did you do to correct it? And how did you learn from it?
When I worked as a nurse in Japan, I get medication to the patients, but I made a mistake to check the patient's name, and they are so similar. So I mistook to give medication to the patient. So I noticed it, and I told the mistake to the doctors, and then also take the vital signs and check the symptom, and also check frequently after the mistake. And I learned the importance of giving medication correctly. And also if I have some bad condition in the shift, I need to go for help if I have a lot of tasks.
How do you handle conflicts with colleagues or other healthcare professionals?
Sometimes when it's so busy in the unit, there are some conflict between some staffs. But at the time, it's easy to happen some mistake for some nurses and PSW. So for me, it's important to communicate with them more frequently.
Can you share an example of how you managed a high-stress situation in a clinical setting?
High stress. When I worked in Japan, if I have a lot of tasks and if there are some schedule for patients, I feel stressed so much. So I just talk to the leader of the nurses, and I shared my schedule with the charge nurse, and if there is some other staff, I will do my task with them.
How would you handle a situation where a doctor gives an order that you believe is incorrect or unsafe?
I checked with doctor.
What if you believe that doctor is giving you incorrect or unsafe information, or is acting incorrectly or unsafe?
If I feel incorrect or unsafe, I check the vital signs or some symptoms by myself, and I assess the patients at first. Then, if I have some concerns, if I don't have much confidence to talk with the doctor, I will talk with charge nurse or some seniors at first. And then if I still have some concerns, I will ask about I will talk about my opinions about the patients, about the order to the doctors.
How do you ensure an effective communication with your team during a busy shift? How do you keep communication going when it's really busy? How do you make sure that everyone's talking and you're communicating correctly?
Depend on the situation, but if I have some rooms, if I have some time to help with other stuff, I will say is there anything I can help? And then I try to communicate and try to share the schedule each other.
And how do you handle a situation where there's a breakdown in communication with a colleague or a supervisor?
Breakdown. How to break down?
What happens if there's a breakdown in communication? What happens if there's difficulty in communicating with a colleague or a supervisor? How do you handle that?
If the conflict happen only between some specific nurse, some colleagues, I will talk with them directly, like not in the workplace, I will say if you have something to share with me, I try to solve by myself at first, but if it's like too difficult for me, I will talk with human list. I don't know, charge nurse.
Okay, charge nurse, the head nurse though.
Yeah, head nurse.
The head nurse. I think that's what we call it, the head nurse probably. Let me just check the baking quickly. Have your shirt on.
And I will take a note.
Okay.
What did you say of the second?
Yes, I'm just doing the interview now. Sorry, she didn't get the job.
Wait.
What? I was talking to a colleague, but you're not getting the job.
What did you say of the second document? Something?
All right, I'll continue on with the interview. Can you give me an example of a time that you've had to deal with someone from a different culture, and how do you explain to them or deal with cultural sensitivities, say for someone who might be Muslim or someone who might be Hindi? How would you deal with that, and what's your methods of communication to ensure that if family members struggle with English, and they have sensitive cultural identities, how do you manage that?
If the patient cannot speak English fluently, I will use some like device to translate to English. And also, if they have some specific culture or religions, I will learn about the culture and religion at first. But I think there is some difference, and there are some like range of in the religion or culture. So I will talk with them like in person, and if there is some like something they want to do for patients, I will provide them. So it's important to talk with them in person, like before I provide the care.
How do you approach educating patients and their families about a care plan?
I think sometimes it's difficult for them to understand the medical terminology. So I will break down the words, and I will use the easy words for them. And then after we decide the care plan for the patients, I will share with the patient or families. And then if I can get the agreement from them, I will provide and I will share with them.
And what strategies do you use to build trust and communication with a patient?
I think if they have some concerns or anxiety, we cannot build the good relationship with them. So I will ask, do you have some questions or do you have some concerns? I will ask frequently, and I will solve the problem if it's possible.
So did your phone go off during this interview?
No.
You didn't? Are you going to make sure you put yours on silent when you go into this interview? The first thing you do is put on airplane mode or in silent mode?
Okay.
How do you handle a situation? No laughing during the interview. This is a hospital. No one laughs.
Okay.
How do you handle situations where a patient refuses treatment or medication?
But if maybe they refuse the care because they have some concerns or they don't agree with the care plan. So I will talk with the patient first, and if they refuse again, I will talk with the families or some important person for them.
What would you do if you witnessed a colleague behaving unprofessionally or violating hospital policies?
It's difficult situation because if I worked as an extern, I started out in the hospital. I am new staff. I'm gonna be a new staff, and I'm not familiar with the situation, so it's difficult to share about the professionals to other staff. But if it's unsafe for patients, I have to figure out how to change the behavior, and I think the hospital have to change something about the situation. So I will talk with head nurse.
What if, say, a patient defecates all over the bed and another nurse says, I'm not cleaning that up, you do it?
I try I think I will do it by myself at first, and then I will share the problem and I will share the situation with other staff. And if it's common for other staff, I have to talk with head nurse.
What if one of the patients is sexually aroused? How do you handle that?
If it's so aggressive and I cannot handle it by myself, I need to talk with other staff. But like some patients who have dementia or some delirium, sometimes it happens. No, I think it happen. It sometimes happen. And if I can handle it, it's not a big problem. It's big problem if they do it in public, but in the hospital. And I'm a nurse. I'm a extern, so I can handle it. I don't feel uncomfortable about the situation. So if I cannot handle it, or if they are so aggressive and they try to hurt someone, I have to go for help. But if I can handle it, it's not big problem for me.
How do you stay current with nursing best practices and continue your education?
Now I'm a nursing student, so there are a lot of chance to learn to improve my nursing skills. But after working as a nurse, I think it's difficult to find the opportunity to improve the skills. But when I was in Japan, I tried to improve my nursing skill with some articles or try to get some certifications. It's so helpful for me. So there is RNAO in Canada. Is the organization try to improve nurses' skills. So I think it can help nurses to improve it.
So a patient is experiencing severe pain, but the doctor is unavailable. What do you do?
I think if the patient needs some medication, that I cannot order the medication, so I cannot do some pharmacological approach. But I can collect the character of the pain, or some areas. I can collect the information and then I will document, and also I can provide some non-pharmacological approach.
Why does it make you excited?
Your face is so serious.
I'm a very serious person.
I think you're good at changing your face. You're
I'm an actor.
Yeah.
I know.
You
I'm
have
very good at it.
experience, but I'm not.
Well,
I was about to laugh.
Yeah.
when I saw your face.
You also be complimentary. Oh, thank you. Yeah, nice day, folksy kind of stuff. And then maybe make a joke like, it smells like dead people in here. Like something.
No, I can't say that.
Can I go down and touch the babies? That's something that they like to hear.